Hello, hi, namaste everyone. I'm audible. You guys are listening me properly.
Yeah, we can hear you.
Oh, thank you. So, thank you for being here, everyone. I'm Lal Kunwar. Currently, I'm working as a service designer at Medic. In today's presentation, I'll share how the CST and ASMS integration, Lumbini Province ECHS program, immunization workflow is helping, how it is helping to health worker and community health worker to track, record, and follow up those child who missed their vaccine, and ensure every child is immunized. Okay, so problem is when the grassroots healthcare system is heavily based on paper process, and it is really challenging to the health worker and the community health worker to calculate the required dose of a vaccine, to notify the parents or caregivers givers when and what dose of a vaccine need to immunize to their children. And also it's really challenging to follow up those children who miss the vaccines. And this CST and the SMS integration, this workflow has that power which can address all this issue and make sure of their areas children is fully immunized. Can you go to next slide, please? If I am little bit fast or my pronunciation not good enough, please let me know, huh? So, so let's see how the workflow works. So I previously mentioned that it's the integration of a CST and a SMS. So in a workflow, you can see the enrollment reminder, confirmation, last of follow-up, and form close section. So for enrollment, so mid-level health worker, like those health worker who worked in a health facility, auxiliary health worker, auxiliary nursing midwifery, staff nurse, are equipped with the smartphones or uh, um, tablets and installed with ECHIS app. In the beginning, they enroll the children by the help of immunization registry or the child health card, and those children who are newborn, those already registered in our CSC systems, and the if the user submitted it, I mean health worker submitted the delivery form, they automatically registered in the systems, so no need to them to add separately. And in a contact summary, the user or health worker can see the list of a vaccine which is injected and which can going to be injected in coming days with a date. It shows, so it helps to the health worker to calculate all the dose of a vaccine, required days of a vaccine on the EPI clinic day. And for the reminder, so health worker will have a 7 days prior task notification so that they have an idea how many children they need to going to immunize on that particular days on a EPI days. And for the children's parents, 3 days prior they get the notification. So when and what kind of a vaccine their children need to be administered. So I'll show all these messages on the during the demo slides. So for the confirmation, so on the immunization day, so health worker open the ECHIS app and open the task, and where then they open the immunization form, and there is the list of immunization vaccines. So they are going to administer the children. And the tricky thing is the one validation we applied there. So the list of a vaccine only appears as per age of a children, and those are remaining not marked in previous if even the child is a little bit more, but he haven't received the previous schedules vaccine, that vaccine also it appear, but once it marks, then it will not appear in next schedule. So it helps to reduce human error, also make the concise the time of form. And for fourth, the loss of follow-up, I previously mentioned that if any children miss the vaccines, then female community health volunteer, we call here them female community health volunteers, They are literally community health worker. So they get the notification. Notification. So your area's children, phone number, the phone number of a baby is there. Is missed the immunization. Please find them and send to them back to the API clinics for the immunization. Like this kind of a message. Community health worker received, and on the basis of that, they visit that children, counseling the parents, and send to back them for FEI clinics for immunization. And for farm close, for there are certain conditions, farm also close. If the child fully immunized, then no need to further task or reminder message for the parents and health worker. Also, if the children migrated from that area, at the time health worker need to submit a meeting form and then no further task and a reminder message. And similarly, if the children is returned back, then health worker can submit on mute form and then again resume the services. And if the child is died, then at that time health worker need to submit death form. So then there no further task, no reminder message to parents. Can I go to next slide, please? Hello. Okay, so implementation area. So you guys already know that. So it is implemented in Lumbini Province. So we have a 7 province. One of them is the Lumbini Province. You guys can see in the map. Currently, we have implemented in 4 districts of Lumbini Province. Banke, Arghakhanchi, Palpa, and Navaprasi. You guys can see where the community health worker pick up the phone, this area in a map. So these are the implemented area. So currently we have a 600 mid-level health workers who are using this ECHIS app, and they are delivering a service through this app. And currently 2,612 community health worker are equipped with the SMS system. So through this they are helping to the system to identifying the missed children in a community. And so far 79,840 children are enrolled, and they are receiving a service through this ECHIS app. Can you go to next slide, please? So theory of a change. This is a blueprint, or we can say roadmap of an intervention. Basically, this is finalized during the intervention design. So basically, in this theory of a design, what kind of activities will be carried out to on the basis of it. I mean, like what kind of activities will be carried out on the basis of that. What kind of short-term, mid-term, and long-term outcomes will come. So you guys can clearly see that what kind of activities, like what the takes role, what kind of activities, and what would be the outcomes, assumption, and the results. So we all aware that, like intervention, like task helps to health workers to understand the number of children, required dose of vaccines, and also we help to parents or caregivers when and what kind of a vaccine need to administer to their children. So we send them a reminder message. And similarly, in a contact summary, the health worker can see the list of vaccines. So it helps to them, like what kind of a vaccine they already received, what is remaining, and who need to be injected to them. And and the form is designed that way. It shows only the list of a vaccine as per age of a children, and once it is marked, it not showing again. So we also take care about the users time and the human error. And also community health worker get the lost of follow-up message, so they can so they can find out the children in a community who missed the vaccines and send them back to the health facility for immunization, for the activities. So health worker will register each children of their catchment area under the EPI clinics, FCSB area. So we can see detailing more in a demo, and I previously mentioned that. Uh, so newborn baby automatically while we are submitting delivery form, it automatically register for the services. Um, and I also talked the form close conditions like when the children moved temporarily or re-enter at that time, health worker do from mute and unmute systems, unmute through the mute and unmute form. So resume the services, and if died, then at that time submitted the death form. So no further task. So similarly, so intermediate outcomes would be the easily know the number of children and the required dose of vaccines, and ensure every children are immunized over their respective area. So here our assumption health workers are enroll every children of their catchment area by help of a immunization registry or the child health card where they have the record, and the health workers are equipped with the functional phones or tablet, and a reminder message will help to beneficiary for upcoming schedules. So follow-up message will help to accept to find out the children. So we mentioned in the message detail of a children, phone number of a parents, and the name of the children. So the final result will be the definitely immunization coverage will be increased and the reduce the morbidity, mortality, and the disability associated with the vaccine preventable disease. Uh, can you go next slide? So probably we need to go on a demo. Yes. Uh, can we do this one and then we'll go demo, or what would be?
Sure. Yeah, let's do that.
Okay, so I acknowledge all these players who supports during this. I mean, who make this possible, who helped a lot us to from designing to the implementation. So here are the key roles of those partners: Child Health Division, MOH Nepal for their initiation and valuable suggestion during a design. On the basis of their ideas, we able to make this design. Similarly, Lumbini Province Regional Health Directorate Office team, so who took the lead and implemented in 4 districts, and right now still they are deploying scale up in more districts, and also UNICEF play a crucial role to support on a Lumbini Province government. Also, I acknowledge to my team members, Pawan, Binod, Nitin, and our former member, Dr. Neeraj, who helped a lot us during this design process. Uh, can you go next slide? So here I mentioned 2 challenges, and the challenges are so health workers are so I forget to mention previously. So currently health work we the medic or the partner given them didn't give them new phones just for this intervention. So health worker are using their own phones. So varieties of phones on the users. I previously mentioned that 600 health workers are using this tool to solving immunization services. So there is a challenge on we noticed on iPhones, and it does not support ECHIS app. They go through the web app, so at the time they need to use the internet, and it's a little bit challenging to them. And then second one is the task list appears too large because of many use cases, and it hassle to health worker to scroll and find out the child. So number of use cases and the number of beneficiary to generate a task for them to visit them. So it's not, we cannot sort as per the use cases, so it comes randomly. So some task might be a pregnancy ANC visit, some might be a PNC visit, some might be a hypertension follow-up, some might be a nutrition. So it's randomly, and it's really a hassle to them. It's a little bit time consuming for them, so need to think about it. So yeah, I already posted these things on a channel, on a CST forum. So we are under discussion on this. Yes, so challenge. So I think this much from my intel. So let's go demo how it works. Can I share my screen? Is my
Oh,
screen is visible to it?
I can see it. Yes.
Okay, so here the name of one health facility, Samsherganj Health Facility. So let's go on a health facility and create a EPI clinics. So you can see here new vaccination center. So we'll fulfill where the EP clinic runs. We need to name of that EPI clinics. So let's give the name KTM City, and we need to also uh, the address near civil line, and how oftenly it runs, like monthly, twice a month, weekly. We have a lot of options. Monthly, let's do a short. We can mark on a monthly, and so the interesting thing is there. API clinics run on a fixed date every month. If it is on a what's the date of today is December 11, so then it runs every December. I mean every 11th of each month. So December 11, January 11, February 11. So even that day is holidays doesn't matter. The API clinics runs. So it's fixed date. So let's put the date 8 and submit. So now it is a submit KTM City API Clinic. Vaccine day is on Nepali 8th of each month, and the address is here under this health facility. Now let's add a community health worker. So name of our abscess is Pawan Kumari, and our phone number is 9848424435. We need to be at 12. The church. Oh, one is, yeah. If you have option, so what's the CAS code? And we don't need to fill up this. So let's make a little bit short. So yeah, no. So now we need to add, we already had the API clinic, community health worker. Now we need to add a household header. So name of a household header is Bishan Kumar. Does she or other household member have a phone number? If yes, let's give them the number. And date of has birth. It's in Nepali, calendar is in Nepali. 2040. Male, Hindu, married. So if see he disabled, this is the contact form. So if we say yes, there are a lot of questions. So I'm not going to add them. Higher secondary school, occupation. Let's do a business. Class, let's do a C3, do an S. So okay, so this number might be already exit. One CST. Let's put one. So next, then if there is a household number, we can put come on. This is the name of a household number. So do you change the household? No. Now, okay. So now we already created the EPI clinics, FCSB, CSW area, and the house. We already add the household header. Now we are going to add a one child. Then we'll fill the form. So name of a baby, Nitin. And the date of birth, let's keep the, it's in Nepali, huh? We are 56 years ahead than the English date. So let's make it 82. So male. So here, parents guys, if we have so if the we haven't add the mothers, we have already add the household header. So if the mother haven't the phone number at that time, we can at that time the system will send the SMS to household header. So if the mother have a own number, so at that time mother can receive or caregiver can receive the uh, reminder message for the immunization. So let's keep one number 6344. Oh, sorry. So son or daughter, this person desirable, no. Okay, and then submit. So okay, so now Nitin Baun is daughter's name. Let's fill the form, immunization. So as per age, it will show the only eligible vaccine. In what so far, how old are she, or until 8 December, 8 January? So is she will be eligible or not for the dose vaccine? On the basis of that, the list of a vaccine will be appear. So make sure is Nitin Bawan is vaccinated, BCG, yes. If so, so in here, the practice is that sometimes the parents move from one place to another places. At that time, they can receive the vaccine from other site. So at that time, also they can keep the record. If they took these services in outside, so at that time they can mark here and mention the name of a health facility uh, when they receive the vaccines. So let's make now. So let's some will make no miss the and yes do an H. So this is the counseling notes. So we keep the counseling notes here just because uniformity on a message. So the everyone give the same message and help to keep the health worker on track while they are delivering a message. And this is the summary page. So you can see here the detail about the Nitin, and then up to date vaccinated, how many vaccines are received, what vaccines they missed. You can see the list of here, vaccine to be administered in the upcoming days, list in here, submit. Also, if we see in a contact summary, so you can see here BCG is marked, they injected today's date, and this is the missed when need to be administered. And also you can see the upcoming vaccines list in here. So while next time Nitin visited in API clinics, the health workers see the list also those vaccine which is missed during that time. Is any questions? Happy to take it. This is from my end. Thank you.
Well, thank you. That was awesome presentation. I appreciated how you pointed out the importance there of kind of the muting workflows and the death workflows and trying to keep the task list under control. I think that's a pretty powerful feature. But then kind of still ended up with such a powerful integrated workflow setup. The task list still ends up being very, very long. I know there's been a lot of conversation over recent months talking about how can we maybe improve the task list there so that the users are able to filter it and see things in a way that's going to be a little bit more conducive to proper workflows. So I'm pretty excited to see where we can kind of keep going from here to really support these super dynamic automated workflows that are able to really support frankly just a huge number of community health workers serving a lot of children there. So that's awesome. And yes, opening up questions.
Great demo, Lal. Let Felix start first. I can see his hand is up.
Hi, Lal. Thank you very much for the presentation. Really interesting. I was just wondering, why do you do the registration at the facility? If you already have the ANC visits, are not the community health workers already following up the babies before they're born?
So why we did a registry in a health facility?
Yes, why is the registration, like not linked to the ANC visits if you are doing them? Because we have then also some pregnancy or, some children that then they get born at home and so on. So I was just wondering whether you have any benefits of including then the facility in that process, or whether you think it could also be done directly linked to the ANC flow.
So immunization program is priority number one, P1 program of Nepal government. So if we see the PNC schedule, postnatal care schedule, so as per guidelines of Nepal, might be a WHO guidelines, they must be visit on a 42 days on a health facility to do a PNC. Even if they have a delivered in a home, they must be come to the health facility to do a PNC. So at that time, they get a first dose of vaccines, BCG. So, and then at that time, they record one immunization registry, and meantime also they made one child health card where they also mentioned the detail about the vaccines. So I previously mentioned that. So health worker enroll the children through the help of an immunization registry and child health card. So our assumption, so we are implementing first time in a community. So there might be a huge number of, the different ages of children in a community. So some of them are 6 months who received two vaccines. Someone might be 1 year who received three vaccines. So heterogeneous group in a community at the beginning of a time, but in a future, so we can link, like I mentioned, so newborn baby automatically registered through the delivery form. So then at one point of a time, so we enrolled everyone, and then for continuously, once the delivery form is submitted, then no need to think about the immunization registry or child health. I don't know, I gave your answer properly or not.
Oh, thanks.
Lal, just to also try to reflect what Felix has said, is there any reason that informed us to focus at the facility and not at the community? Because per your presentation, you have indicated we already have CHWs working in the community setting. So why do we prefer registration at the facility and not the female community care workers to register?
Got it. Yeah. So Anthony and Felix. So right now we have a female community health volunteers, and since last 3 decades they are serving RMNCS services in community. And at that time's criteria, while the while the concept is creating on 1988, so there is no literacy on the requirement. So most of our community health workers are illiterate, probably more than 40-60% might be. Dr. Nitin have much more idea on this. And yeah, we have a less literacy rate among community health worker. So it's really challenging to them to give this Android phone to them, to fill up, to register. But right now, government is taking one step ahead and making version 2 FCSP, who are like a community health nurse. They are piloting in different areas of Nepal, and we are also partner for them. And yeah, so it's only because of the literacy issue of a community health worker. Yeah, Dr. Nitin.
Thank you. So also to add on that, the thing is, the question is important, and one of the thing is like at the current moment where we have deployed this platform, there are no digital platform at the health facility level, except for the DHIS2 application, which is more like a data aggregation and for data collection, but there's no application or platform to track the service delivery. So what we discussed, and one of the requests from the government was like, although we have explicitly mentioned that this application, that the CHT is primarily for the community health workers and for the community health use, they sort of requested us to deploy this application at the health facility level for an interim period of time. The province where we have deployed this application, they are already in plan to deploy a platform, a dedicated EMR platform at the health facility level. Once that happens, what we will do is we'll remove the health facility based user and we'll only have the community based level user. And one of the things that is currently undergoing is we are doing an exercise with one of the German funder who will be supporting the health facility level platform. So we're planning to and working out to test out the interoperability part of CHT and the proposed platform for the health facility level. So this is just for an interim moment. In the future, CHT will be entirely dedicated at the community level, and another platform will be selected for the health facility. I hope that answered your question.
Lal, one last question. I know we don't have a lot of time. What happens to children who don't come to the facility and the healthcare provider has a task? My assumption is the task doesn't disappear, and that might because it might be one of the reasons why we are having also a lot of tasks.
So we kept, I'm audible? Okay, so we kept the task, so for the immunization, we kept the task for the 2 years, until 2 years. But there is phone number, health worker can have that phone number, so they can make through the phone calls. They can also make sure if they injected in a outside, I mean the other health facilities, if there is no need to do a mute or unmute, but they visited somewhere and they injected, I mean the mother-in-law home, and they injected there. At that time, like healthcare I told you there is one checkbox they can make mark if they administered it in the outside. So that at that time it also resolve the task. Yeah, but we kept the task up to 2 years.
Awesome. Any final questions here? If not, thank you again, Lal, for a great presentation. Thank you for taking us through all of that. That was awesome.